Hi everybody, welcome to Thea and Olaf. My name is Irene. With me is Olaf, our Siamese doggy. And today we want to share what you can expect when it comes to neutering your dog. Olaf was neutered and overall it was a very smooth procedure for him. But with any type of surgery, there are some risks, even if it's very low. So neutering is a very common procedure done to male dogs in North America. And overall, we knew what to expect, though there were a few surprises in terms of what was actually done. So this video is meant to inform you, to let you know what actually happens behind the scenes. It's not meant to scare you in any way, but you can use this to ask your vet any questions if necessary. So what exactly is neutering? Neutering is a surgical operation done to male dogs in which the veterinarian creates an incision in the front of the scrotum, and they then remove the dog's testicles. In most cases, the scrotum is still left intact. We were a little bit surprised with this with Olaf to still see his scrotum still hanging there. But because Olaf is a mature dog when he got neutered, the scrotum will still be there. Because Olaf does have long fur, it helps cover it to make it less visible. For dogs who haven't reached full maturity before they are neutered, the scrotum will shrink in size after being neutered. There's a little bit of prep when it comes to neutering your dog. Obviously, you have to schedule an appointment to get your dog neutered. And for us, it wasn't too bad to get a date for Olaf. It was very easy. After that, a few weeks prior to the neutering operation, there should be some blood work done on your dog to make sure that there aren't any concerns before the procedure. And then the night before being neutered, the dog should not be fed somewhere around 10 p.m. to midnight, just to make sure that any food in their stomach won't cause vomiting during the surgery itself. Let's talk about what happens during the neutering procedure itself. So your dog will be put under general anesthesia. Olaf was given midazolam, which helps him relax and sleep during the procedure. Then a breathing tube is put down your dog's windpipe or the trachea. The point of this tube is to deliver oxygen and gas anesthetic directly to your dog's lungs. And your dog's heart rate and oxygen levels are monitored by a machine during this whole time so that the vet can make sure that your dog is comfortable. I should also note that the breathing tube can cause irritation or coughing in your dog after the procedure. Lastly, there is some shaving done for your dog. The point is to make sure that the hair and bacteria don't go into your dog's bloodstream. Olaf was shaved around his genitalia area. He had a shaved ring around his leg for the IV to go through. And then they also shaved a little bit of his butt fur too, which I was a little bit surprised about. I was concerned that Olaf's fur wouldn't grow back right, but his fur is growing back nicely, and for the most part, you can't see the parts that were shaved before. Then of course, there's the actual removal of the testicles, and after that are the stitches. So the veterinarian will stitch up the incision site, and there are two types of stitches that they can make. One kind is the dissolvable stitches, which means the stitches go away on their own. And the other kind is the non-dissolvable kind, which means the vet has to follow up and remove them. Lastly, you wait for your dog to wake up from the procedure, and then you're sent home with pain medication. So Olaf was prescribed Rimadyl and Gabapentin. The main side effect with Gabapentin, though, is that it causes your dog to be sleepy. We specifically requested an alternative to trazodone, though, because trazodone can cause a loss of appetite, which we've experienced with Olaf. So Olaf was definitely sleepy with Gabapentin, but overall, he did well with that. Finally, your dog will be given a cone to prevent them from licking their incision site, and you'll be told to let your dog rest for the next 7 to 10 days, after which your vet will check on the incision site and the stitches to make sure that everything looks okay. Note that if you have a high energy dog like a Sammy, like Olaf here, you may struggle to find ways to keep your dog entertained during their period of rest. But it's important for them to not even run around, jump, or even go on walks. So to keep them occupied and to burn off energy, I suggest plenty of mental stimulation, puzzles, new chews, and toys to keep them entertained during this period of time. Overall, I would say the neutering procedure for Olaf was pretty smooth. It took about a few hours from start to finish. And the cost of the procedure for Olaf was about $660 for neutering itself. And we also requested some hip x-rays at the time, and that was an additional $300. So overall, the cost of neutering plus the x-rays was about $1,000. So it's a pretty large amount to be aware of. And because neutering is an elective procedure, it's not covered by pet insurance. So make sure that you have the money saved up for that. In case you're wondering why we did hip x-rays, it's because Olaf's breed, the Samoyed, is prone to hip dysplasia. So we wanted to create a baseline for what Olaf's hips look like now and then track his health over time. Finally, I want to mention that neutering will probably not change your dog's underlying personality or any behavioral issues. Olaf is not calm after being neutered. He's still pretty high energy. He can still be pretty reactive around dogs and new environments. So don't expect that as a cure-all for any problems you're experiencing now. You'll still probably need to work on training if your dog is reactive like Olaf. So that's it in terms of what to expect when it comes to neutering your dog. We'll also list the medication that was given to Olaf as a reference below. And if you have any questions about neutering, how it was for Olaf, feel free to leave your questions and comments below. And as always, if you enjoy this content, be sure to like, subscribe, and the bell for notifications.
Thanks for watching.